Hello, everybody. Joining us today is Dr. Mohammed Enayat, the founder of Human Lab, a pioneering clinic that blends cutting-edge science with holistic health to help people live longer, feel better, and thrive. After years in the conventional medical system, Dr. Enayat saw a huge gap between treating illness and cultivating true health. Now he's helping individuals biopersonalise their well-being from gut health and sleep to hormones, immunity, and longevity.
Dr. E, welcome to the Raise podcast. You're at the forefront of what many call the future of healthcare. Can you tell us what Human Lab is and what inspired you to create it?
Well, firstly, thank you for having me today. It's a real pleasure to be here with you both. So Human, HUM, the number 2N, is the name of our clinic. It's got the 2 because we want people to feel the best they can. We want to raise them to their 2.0. And we do this through deep testing. We start with a data dive. We look deeper than traditional medicine trains us to look. And what we're looking for is imbalances before they become diseases, before the earliest signs of dysfunction rather than disease. And through deeper testing, we identify those dysfunctions, then we seek to treat those dysfunctions. We utilize everything from nutrition and lifestyle strategies, empowering our patients to understand what they can do themselves in their own environment to modify their environment so that their body can work better for them and they can overcome those dysfunctions. And we prescribe people supplements, peptides, bioidentical hormones, and or medication, and we see them improve their health continually over a program of care. And then in the physical clinic, people can come in to do a range of therapies. So we've curated a suite of therapies that we then prescribe to our patients to get even faster results. Things like hyperbaric oxygen therapy, certain types of intravenous therapies like NAD+, one of my favorite, and other types of stem cell therapies, regenerative medicine therapies. And so ultimately we're a health system or a health model that looks deeper, that treats our patients we work with our patients together on a journey of care, and we've got a wider range of tools. And in doing so, we've treated a whole range of patients. Patients that come in with that they would describe themselves as healthy, but they're looking to perform more. So athletes or everyday athletes, all the way through to people that are in complicated health states, and everything in between. People that want to optimize their fertility, or they want to improve some symptoms that they go to the doctors about. The doctors don't know why they have these symptoms. So I really thoroughly enjoy this type of medicine, and it's a real privilege and honor to be able to practice this type of medicine. Really
amazing.
And what inspired you to actually start the clinic initially?
There was nowhere else I could do this. There was nowhere else that was deploying this methodology, this philosophy of looking at the human body before it had disease and applying a scientific approach. There was no one that had IV therapies and hyperbaric oxygen, and were integrating doctors with nutritionists and utilizing the deeper lab tests that I wanted to use and utilizing supplements. And so if there wasn't anything, they had to go about and create it so I could practice that type of medicine. And I started that process about 10 years ago, and I haven't looked back ever since.
Well, thank you for doing so.
Yeah.
It's a fantastic place. I visited recently. It was amazing.
Thank you very much.
Dr. E, how do you see healthcare evolving in the next 10 years?
I'm really excited. I was really excited 10 years ago, and then I started to try and talk about this type of medicine around that sort of time when I started learning functional medicine, regenerative medicine, and personalised medicine. And at that time, when I came back to the UK, because I studied and learned a lot of these practices abroad, America, Germany, Austria, after my GP training, I came back to the UK and I would host talks and events about, being healthier even before you're sick. And it was like falling on deaf ears at that time. And I kind of lost hope for a little while. But I think over the last few years, in the UK particularly, I'm really enthusiastic about everyone's understanding and that they can improve their own health wherever they are at on their journey, and that they can do things themselves, and patients are looking around and they're willing to try different things. And it's only through curiosity that you get to really, when you spark that curiosity and you go searching for answers, you'll find those answers over time, usually. And so I'm really enthusiastic. That's number one. Another reason why I'm really enthusiastic is that I'm also now seeing a whole host of health professionals that are looking and being interested and approaching us all the time to say, hey, can we learn with you guys? Can we practice medicine with their GPs? I get referrals from secondary care specialists now.
Amazing.
From orthopedic surgeons, from cardiologists, cardiothoracic surgeons, cancer doctors, oncologists that say, look, we want to see if we can think about the sorts of problems that we face in clinic day to day from a different perspective.
That's really exciting.
Yeah, which is really exciting, right? And so that's the second reason why I'm really excited. I like to have lots of reasons why I'm excited.
Why not?
Yeah, exactly. You need to find them, right, in life. Otherwise, and the third reason why I'm really excited is because of technology. I think technology can really help us, can hinder us, and cause us to be in a health state more often than not, but it can also really help us. And I think particularly for this type of medicine, the role of AI with smart doctors that have the knowledge together combined can be really, really powerful, because we can consume a higher volume of data sets or data points about you, consume that information, make it make more sense, and then put in smart plans that we can follow using AI to consume that data. So those are the three reasons why I can give you more.
Amazing.
Love that.
Yeah.
They're fantastic.
Yeah, I think a lot of people kind of feel quite let down by the NHS and the services available. And I really do think that the future of healthcare is changing this way and becoming more personalised and holistic. So I think it's great that you kind of made space for that.
Yeah, and you're at the forefront of it all.
Yeah.
It's really exciting.
Yeah. What do you think are the biggest flaws within our current healthcare system, and how are you trying to address that?
Yeah, so I mean, I think there's some fantastic things in our healthcare system.
100%, I totally agree. Yeah.
And the fantastic things are based off the philosophy of looking at the human body and not wanting people to be dying from disease. And so everything is followed off the back of it. The way that we innovate, the way we drive research, the way we fund, the way we educate is all about identifying disease and then finding lots of ways to treat the disease, to manage symptoms. And that's got people living longer to a certain degree. But what we've now seen is that people are living longer in a debilitated state, right? So they are now, we're no longer dying in our 60s. We're now dying on average in mid-70s. But the last 10 years of our life on average, we're carrying a debilitating disease. 1 in 2 people by the age of 50 have a chronic disease, right? That's 1 in 2.
That's
and
young,
then
isn't
from
it?
1,
To live
which is young,
with that, for that long.
For the rest of your life, you'll have that chronic disease. And then 1 medication turns into 2, turns into 3. 1 disease of 1 organ starts to affect other organs. And this is where the downward cycle starts. So I think, and we're now also seeing that the life expectancy is starting to turn down in the Western world for the first time ever. Really interesting. So we know that, we've done that philosophy, we've done a great job, but now we have to change our attitude to health based off science. We have to look at the human body as what it is, which is a set of systems, cells that slow down over time after 28 and then ultimately start to deteriorate and then cause dysfunction and then cause disease. So we have to start looking sooner. We have to look to engineer health, not just manage disease. And that's a whole different way of looking at health, which requires a whole different way of educating our doctors and a whole different way of adopting and funding research and adopting innovations that happen in research labs. So I think that's what needs to happen. We have to fundamentally go back to the Oxford English Dictionary and redefine what health is. Because currently the definition is the absence of disease. It shouldn't be. In my opinion, the definition of health should be the absolute state of vitality you can experience. as a human being,
Yeah.
right? Because we all know what that feels like, because we're all now past our mid to late 20s. But if we think back, I
The
hope
good old
I know, I was like,
days.
oh.
Yeah, the good
that
old
was a little
days.
nervous
Yeah.
moment. I actually don't know how old you guys are.
No,
But
you're right. Yeah.
You're right.
you're so mature. And yeah, anyway, so you know what I mean. As in, like, we can go back to what vitality we experienced in our mid-20s, bouncing off the wall, energy, sleep a few hours but still feel fine.
Mhm.
Our detox works well.
I was just going to say,
Our
be able to
immune
get over a
system-
hangover very
Yeah.
easily.
That's a common symptom I refer to, is like, you can drink and the next day you feel absolutely fine, whereas these are all symptoms of the body slowing down. And can we take that system back? Of course we can, if we treat it early enough,
Okay.
right? If we're looking early enough, we can start to engineer your systems in your body to work better. We can support those systems to work better. And when they do work better and they're in more harmony, you produce more health, you produce more vitality. Yeah.
Mhm.
And so, yeah, so this is what's possible, but it requires a whole new philosophical shift in the way we think. And that's for health professionals and the economy of delivering health services. On the consumer side, it requires an attitude shift as well. And that attitude shift you alluded to at the beginning of this podcast, that attitude shift is, I grew up at a time when I remember one of my first young memories was being in a funeral, and it was of my uncle, and just listening to people saying, when it's your time, it's your time, almost like accepting disease and accepting death.
Mhm.
And I feel like that attitude has to change now, and it started to change, but we are the generation that has to not take that older generation's view around health, where the doctor knows everything about your health and the doctor gives you the prescription, and you give the responsibility of your health to the medical system. Now we have to take responsibility ourselves. We have to acknowledge, firstly, how we live now is how we will live in the future. The decisions we make now will affect how we can show up in the future. And that's something we understand when it comes to our finances. That's something we understand when it comes to our relationships. Something we need to understand when it comes to our health. And health is required for everything, right? It's your absolute, it should be your non-negotiable. You know that if you want to have a quality of life, you need a quality of health. You can't have a quality of life without a quality of health.
Well, you could have all the money in the bank, but if you're not feeling well and you're not able, you can't enjoy it. So what's the point? You know?
Absolutely, right? And we can all correlate to that. Those days that we haven't slept, where we haven't fed ourselves well, where, what happens? We're not making the best decisions. We start to get a bit restless, agitated. We might lose our temper more easily. We might flare up more easily, whether it's our children or whether it's our relationships, whether it's our colleagues. We know when we're off kilter. That's just a small insight if you haven't got disease. And then when we're sick, we've all experienced elements of sickness, some flu-like symptoms at the minimum, and we know how rubbish we feel. We can't go and enjoy our quality of life in those debilitated states. So let's not take our health for granted, and let's not give the responsibility to a healthcare system. Let's take responsibility ourselves. Let's listen to Rays and let's put some of those things into practice, right? And try it.
Yeah.
And it's through trying and then just noticing how you feel afterwards that you start to kind of put it into your memory bank, that when I feel rough, I'm going to do this.
Yeah.
Okay. You're going to put the interventions in sooner. So that self-health has to be a philosophy and a way of living if we're looking to have an increased quality of life for a long period of time.
Totally agree with that one. So can you explain how human uses data and diagnostics to create personalised health plans?
Yeah. So first things first to understand is when you go with a symptom to your doctor, they will usually look at a few markers related to the organ that causes that symptom. So if you've got an energy problem, they might screen you, if you're lucky, for your thyroid, because the thyroid's quite implicated in energy. They might look at your iron levels. They might do your vitamin D, but that's about it. Whereas at human, we go the other way around. We look at all of the important systems in your health and attach all of the important biomarkers to those symptoms. So our starting baseline panel, whether you have symptoms or not, we call the foundational panel of testing. It looks at over 100 biomarkers that represent different important foundational systems that are required to produce health. So we're looking at your immune system, your inflammation status, your micronutrients, magnesium, vitamin D, B12, activated folate. We're looking at your hormones, your thyroid, your adrenals, your stress hormones, your sex hormones, and your pituitary gland, and also your growth hormone levels through IGF-1. We're looking at your kidney, liver, usual screening as well. And we're looking at your deep cardiometabolic. So looking at how you metabolize, create energy, how do you draw on sugar? How do you draw on fat as an energy source? And do you deposit that in your blood vessels? So it's about 120 markers. I forgot to mention we also look at gut health markers as well, because that's definitely overlooked by traditional medicine. We only think about digestive health from stomach ulcers, gastritis, or colonoscopies looking for ulcers in the, that's the common bread and butter things we're looking for. But from a blood test perspective, we're not really testing your digestive health. So it's really good now that there are some blood test markers available that tell you if you have leaky gut, i.e. you're not absorbing your nutrients from your food.
So you can check that through your blood?
Through your blood.
Okay.
Yes, and looking for bacterial overgrowth.
Yeah.
We hear about the microbiome. What does that mean clinically? What's the applicability of that? And so we're looking for something called lipopolysaccharides, which is, or LPS, an endotoxin produced by certain bugs, bad bugs, gram-negative bacteria. When they overgrow, they cause bloating, they cause other symptoms that can drive inflammation within the body. When you look in this way, you put it on upside down, you're not looking for a few markers related to the symptom, you're looking at you as a whole human, okay? Then you start to put pieces of the jigsaw together. You can start to talk to patients about symptoms they experience they don't even know are symptoms.
Yeah.
Yeah.
Well, we kind of normalize so many symptoms nowadays, don't we, as being normal when they're not.
Yeah, and the classic is, things like PMS, especially for women, like some, is it normal to have PMS? I don't know. I'm asking you guys.
We're asking you.
Yeah.
You're the doc.
What do you think?
I mean, for us,
I think there are different levels, aren't there? I think.
Yeah.
But I know if I've eaten more sugar in a month, I honestly notice the difference.
And
or if I've
sleep.
had more caffeine or sleep, so I can tell if I've had a month where it's midsummer and I've been on numerous partying trips, I will feel it that next period. So I know that there are certain
It's
things
like stress
that you can
on the body. I think it can feel, but then maybe that's just an accumulation.
Absolutely. No, you're 100. You feel exactly how you feel. Now, if you ask a doctor, what do you think the traditional doctor
will say
yes, kind of within the normal range of being normal. You haven't got a disease. Is there some imbalances driving that? Now you come to our world, personalized medicine, we're looking at do you have estrogen dominance? Question number one. Is your estrogen to progesterone ratio elevated? Because symptoms of that are polycystic ovaries, PMS, and other hormonal imbalances. So we can look in your bloods and look to see for signs that you are not detoxifying or removing or metabolizing your estrogen well compared to someone else that doesn't have as much PMS.
I had this not too long ago, and I got my bloods tested and my progesterone was low, so it means my estrogen was kind of a bit higher. So I think it was a case of not being able to flush out the excess.
So that's one window. If you want to go a bit deeper, for our patients that have fertility issues, or for our patients on bioidentical hormone replacement therapy, where they're just given lots of estrogen on top without checking how you individually metabolize estrogen, because each of us does it slightly differently based on our genetics. Some people have a mutation in a gene called COMT.
Right.
And what that means is that for those people, they do not detoxify their estrogen metabolites. Well, there's several types of estrogen breakdown products. Most people go down a healthy path. Some people do not. And it goes down creating a metabolite of estrogen, which actually is shown to increase breast cancer risk. Okay? So this starts to explain why some people could be elevating their risk. So for us, when we're doing bioidentical hormones, we're doing something called the Dutch test for our patients, which clearly shows what metabolites you're producing, and therefore we can then personalize your supplement plan that goes alongside to make sure you've got a healthy way to break down estrogen and you're not accumulating too much of it, which could put you at increased risk at the minimum of emotional symptoms, at the maximum of, let's just say, potentially cancer risk. And this is what personalized medicine is all about, right? It's, you see the vast gulf in difference in approaching someone with a non-symptom. We see everything as actually as a symptom, and that's and we're looking for imbalances and how to make the orchestra work better within our biological systems.
Amazing.
Yeah.
Sounds incredible. What do you think are some of the most powerful habits that people can adopt in their everyday life to kind of increase their health span?
So I think let's talk about, we all have heard about the different pillars of health.
Yeah.
And what we mean by those pillars of health are things that you can do that you can control in your own environment.
Yeah.
And so you talk about your nutrition, talk about movement, talk about how you respond to stress and stress, your own response, but modifying the stresses around you, toxic exposure, as well as purpose, mission, values, community, tribe, all of those things that play such an important role. So some of the things that you can be doing is taking a step back and thinking about yourself as a Duracell battery. Think about yourself about always consistently filling your reserve back up, of recharging your battery. And then we'll talk about things that recharge your battery. And then there's things that you use your battery with. You use that energy that you produce to do things. Think, digest, move, sit around, have a podcast chat. All of this requires energy that we're consuming from the energy we produce.
Yeah.
The question number one, how do we produce energy? We produce energy from oxygen that we breathe and the nutrients that we take from our food and or supplements, and that requires an efficient digestive tract to be working well to do that. And then around that is also secondary to that is your kind of hormonal balance as well. So I would say start to think of yourself in that way, and then notice that on the times you're not replenishing your battery, what that does to how you show up. And so work on replenishing your battery. Replenish your battery by having clean nutrition. I keep it simple because I'm sure you've had lots of great advice and speakers on this, talking about nutrition in more depth. But keep things simple. I'll keep it simple for the sake of this conversation. Just clean food. Try and not have over processed foods. Monitor your sugar intake. Avoid refined sugars if you can. Use food as fuel, not as comfort. And then also alongside that, if you're getting bloating, if you're getting non-specific symptoms, dry skin, irritated skin, inflammation, you're not recovering as well, maybe some some bloating as well, try and remove the common triggers that drive inflammation within the body. Things that we're overexposed to over time, like dairy. Now, cow's milk, remember the adverts growing up, drink your cow's milk, the milk floats going around. And over time, the industrialization of our food chain to mass produce things like milk, dairy, and then bread and wheat has meant that we're not getting the cleanest source of these. And as such, they've put chemicals and additives in them, which has given us things like leaky gut, porous digestive tract, which causes, every time we have the milk, a slight immune response, a low-grade inflammatory response. You could have that. It's quite common to develop leaky gut over time because we're so exposed to chemicals and toxins in our environment. So you can trial just removing certain foods. Start with dairy, then try removing gluten just for a few weeks. See how your body responds. Maybe your energy goes up. We see it a lot. People's water weight goes down. They get more spring in their step. I think that's a simple thing that you can trial. If you do have that, it doesn't mean you need to be off those foods forever. You want to address the root cause. You want to work on the leaky gut. And that's quite easy to do through specific targeted supplements and when you do some specific testing. So that's a trick and an insight I've learned on nutrition over time. Another thing that I see on the movement, move to the other side, which is taking oxygen in, right? to do that efficiently, you need a good cardiorespiratory system. Okay. And, I know you've had Jamie on the podcast. He's a great breath coach, and he will teach people on how to breathe in properly and modify your sympathetic and parasympathetic nervous system, which is a great tool. But your pump is important, and your plumbing is important to work on. Your heart and your plumbing, your blood vessels.
Yeah.
How do you improve that? You have to, if you don't use it, you lose it. Okay, that's the way the biological organism works. So you've got to use it, which means that you've got to do things that bring your heart rate up. So look, and in two ways. One way is the predominant form of exercise you should be doing is zone 2 training, which is getting your heart rate to, let's just say 100 to 110 beats per minute to 120. Everyone's slightly different, which is like a light jog or brisk walking. Okay. And then another type of exercise, you should be breaking a sweat. The number of people I ask, do you break a sweat in a week? They're like, no.
Wow.
I just tell my patients, just try and break a sweat once a week, then go to twice a week. Yeah. And that requires you to go slightly higher in your heart rate. If you haven't run for a long time, just try go for a 10-second sprint. Get your breath back and sprint again. Just try it, right? Or run up the stairs instead of walking.
Okay, yeah, I could do that.
But do you know what I mean?
Yeah,
So,
of course,
and when you do that, you start to use your cardiorespiratory system, and it starts to grow back and be functional, and your ability to take in oxygen improves and exhale. So that's the other part of making energy. Sleep is super important. I know you guys have spoken about that a lot. And sleep is when you regenerate and you heal yourself. Your thymus gland produces T cells at night in your deep sleep. So I would say track your sleep if you can. Look at getting a sleep tracker. Know how much sleep, what type of sleep you're getting. Not just the total amount of just staying in bed. Are you getting enough deep sleep? Especially if you're prone to immune problems, you've got disease, you've got some disease processes going on. The most important sleep stage for you is deep sleep, because that's when your immune system is most active.
How can people improve their sleep if they struggle to get into a deep sleep state?
It's going to be allowing your body to slow down. Okay, so avoiding exposure to stimuli, especially digital. That's why you hear about blue screens, blue light, and digital stimuli. A few hours before bedtime. Avoid overactivating your digestive system too close to bedtimes. That's why they say, because that requires energy, stops you.
I heard Brian Johnson stops eating at 11 a.m. because of that reason.
11?
I know that's extreme, isn't it? But
What time
he
does
said
he
he
go to bed?
experimented
7 or 8 p.m., doesn't he?
But he's experimented with all the different times, and he said 11 a.m. was the most optimal time to stop eating for your digestive system to be able to.
I think that's a bit extreme.
Yeah, I know, it's 100%. I just thought it was interesting.
It
Not
is
very
interesting.
accessible, is it?
Yeah, no,
No.
I mean, but 3 hours, we say 3 hours before.
Okay, cool.
3 hours before bedtime.
That's doable, yeah.
We know that drinking also disrupts our sleep, right? Even though we might feel like we're sleeping better, but actually it's a much lighter sleep. It raises our body temperature as well. And so kind of avoiding drinking if you can as well. And then a cooler room has been shown to also promote deeper sleep as well. So those are the things that you can do to kind of improve your deep sleep.
Okay.
So I think those are some kind of quick starters. And I think the last thing on exercise is strength. We don't forget about our strength. We need our muscles. Our muscles house our mitochondria, especially our proximal muscles. So proximal muscles, quadriceps, hamstrings, glutes, core, and your abs. They are a high concentration of mitochondria. So it's super important that we maintain muscle mass in those muscles. And what is the other thing that we think about in old age? What are the chronic diseases that come in old age? It's cardiovascular disease related to sedentary lifestyle, poor dietary choices. It's back pain related to loss of muscle. When we lose our muscles, our joint space narrows, then we get arthritis, okay? And the same thing with the discs of the spine. As the muscles atrophy, the discs sit closer together, you get bulging, trapped nerve, sciatica, pain, immobility. It's not a cycle we ever want to be in. So we have to make sure that we work against the trend. The trend after 30 is that we can't put muscle on as much. It's harder to put muscle on. So unfortunately, we have to work harder to maintain our muscles, and that's where therapies, that smart therapies, can come in to accelerate that. But I believe that
smart
exercise,
therapies?
things like hyperbaric oxygen therapy,
Yeah.
that's really powerful, because that stimulates an environment for your bone marrow to produce more stem cells so that you can grow more tissue. You can grow more muscle more easily, right? And so you're constantly producing new stem cells every time you do the hyperbaric. And it stimulates the release of growth factors that creates new blood vessels. So you're delivering, your plumbing improves. So you're delivering the oxygen that you breathe and the nutrients that you take from your stomach and digestive tract into your blood supply, and delivers around your tissues better, so your cells can work better. Your individual cells that have the mitochondria and the DNA in it can work better. And we're a collection of trillions of cells. So if we can make the cells work better, the whole body operates better. The whole
Makes sense,
organism
yeah.
works better. Yeah. So that's why I love hyperbaric oxygen therapy. You know,
Your chamber's incredible, a human. I've never been in one
Is
so
it?
big. Honestly,
Is
it's
it a big
4
one?
people can sit in there.
Oh.
And
Oh,
I
you could
actually
have
had
meetings.
Yeah. So I actually had an NAD drip
While you were
whilst
in
I was
there.
in there, and I was like, this is a vibe.
Ah.
Yeah.
yeah, super
Because
comfy,
in
right?
Brighton we've got ones where they're just like the blow up ones, but your one's incredible.
Yeah, thank
It's
you
like
so
being
much.
in a spaceship.
Yeah, no, and you know, I worked in stem cells in 2007, and I've always been following the stem cell space and the philosophy of how the human body can regenerate itself. Is designed to, but it slows down. Our ability to regenerate itself slows down. That's why I really loved when I came across the understanding that hyperbaric medicine or high pressure oxygen therapy stimulates stem cell production. I was like, wow, there's not many treatments that can do that.
Wow.
You don't need to go for an
And it's
expensive
so
stem cell
accessible
infusion.
for so many, even if you're really ill, you know, it's one of those environments, isn't it, that people are
accelerates
able
healing.
to,
Yeah, and I've seen it was the first technology that I, heavily invested, to get that kind of
that must have
remortgage.
been,
Yeah,
yes,
remortgage. My
huge.
parents helped let me remortgage their house to help me, to
Wow.
help me build it out, and thankfully paid off. And it's been great. It's been great applying this type of medicine and knowing that, okay, I'm just working on the stem cells, trying to get more growth factors, and can apply that to people that have disease and before disease, and seeing the results of that time after time to a variety of patients. It's been great. And that chamber has helped heal a lot of people with a lot of different conditions. So I'm a massive fan of hyperbaric. And when you combine it with the NAD, what you're doing basically is you're flooding the body with oxygen and then flooding it with the nutrient of NAD, which helps make energy better in each cell. Because guess what happens to us as we get older? Our NAD levels drop.
Everything bloody drops.
So who should be taking NAD?
Everyone.
Everyone.
Yeah.
In
So
my
I'm just wondering
opinion.
if that's something even forgot,
Yeah.
just thinking. My husband's got a long-term health issue, but he is doing oxygen therapy 2 to 3 times a week, going to the chambers. So I was like,
Yeah.
maybe he should be taking NAD at the same
100%, yeah.
time. Yeah.
And it's we make NAD from our foods, but we don't make it at a fast enough rate. So at 20-year-olds, we across the population studies that have been done, by the age of 40, we've only have 50% on an average population compared to a 20-year-old cells.
Okay.
By 60, it's even less.
Yeah.
Right. So it's really dropping, and so if we can replete our NAD levels, we increase our cellular energy potential, how much energy we can make in each cell, and that energy gets used to healing, gets used to concentrate, etc., etc. And what depletes NAD levels? It's stress, it's not sleeping, it's inflammation, it's disease that rapidly depletes us. So I first introduced NAD plus during COVID. During COVID, when all the clinics were closed, came across NAD and was trying it with patients that had, I don't know if you knew many people that had severe fatigue and severe brain fog from COVID. Do you remember those patients that were getting long COVID and
yeah.
severely debilitated? I was like, okay, let's try the NAD with the hyperbaric. They were coming in for hyperbaric oxygen. We were doing a bit of functional medicine, getting some good improvements. And these were patients that went to the long COVID clinics and just not getting any improvement. And we were getting good results. And then we tried the NAD and it just accelerated their results and got them back. As you build up that battery reserve and get past the reserve point, then the systems work by themselves. That's why I see it like a Duracell battery. When you're in the reserve phase, it's hard for your body to get yourself out of it. You need the support. And once you're above that, then your body can start working to fight that disease process itself. And that's when I fell in love with NAD, and I said, okay, this really is a powerful tool. I think it's superior to the oral precursors. You might hear about the oral supplement form, the NMN and the Nicotine NR supplements. We have trialed that. Now, NAD works on three main ways.
Because you deliver it intravenously, don't you?
Or subcutaneously, yeah.
Okay.
And we have tried, we have recommend, and there is a role for the oral as well, but I'll tell you the three ways, three main ways that NAD work. One is on the longevity pathways. These are pathways that go on all the time to clear up the damage that is happening within our cells. Misreplication of DNA, of the cells, etc. That's called the longevity pathways. The oral precursors work on the longevity pathways as well as the NAD, the actual NAD itself. The second pathway is to create more cellular energy. So that's evolved in the mitochondria, taking oxygen and making energy, and giving you the effect of more energy. And the third mechanism is increasing our dopamine levels. It's a precursor to dopamine. So it improves our motivation levels as well. And that's why it's used clinically in people that are low in dopamine, people that are substance abusing, because they're caught in a cycle, their dopamine is very low. So it's used clinically to help people come off alcohol addiction, for example. Right?
Interesting.
Because it helps replete their dopamine, gives them more motivation, and they can get through the first 12, 18, 24 hours, which is often the worst part, and they continue doing that for 5 to 7 days. And so the oral precursors don't give you as much clinical effect on energy or motivation, I've found.
Okay.
But they do work on the longevity pathway. So if you're just
they're still beneficial to take, but in an ideal world.
In an ideal world, that's for us.
Yeah.
In the human world, we recommend our patients to do the subcutaneous or the intravenous, because it gives them more.
Okay.
They will notice more effect from it. And that's what I want my patients to feel, they notice the difference. So yeah, NAD is great. Really like that as well.
Nice.
Yeah.
Can you explain to the listeners, because I feel like a lot of people are talking about this at the moment, the difference between biological age and chronological age?
Absolutely. This is trending right now.
Yeah, exactly.
At
So
the
I thought we'd
moment,
bring it up.
Yeah, so biological age is a notion that you can measure the rate of aging inside your body. And your chronological age is time, how much time you've been on the earth for, right? So chronologically, I'm 41. My most recent biological age test was 35.
Nice.
It's nice on the surface, but 18 months prior to that, my biological age was 24.
Oh,
What have you done?
Correct.
Interesting. Okay.
12 months prior to that, my biological age was 22. Okay. And then.
Okay, what's going on, Dr.
think-
E?
Exactly. And I look back at what's going on.
Yeah.
And this is a perfect case study. I started commuting 2.5 hours a day over the last 18 months.
Okay, so you moved, I was going to say, did you move
I was
house?
close to my clinic, gone, a bit further out. And it takes me, I'm 2.5 hours commuting each day. That 2.5 hours previously I was using to food prep, exercise more, had more time to kind of journal, just be, be right?
yeah.
And I think I was reflecting back and I was like, that was probably the biggest change for me.
Okay.
And because I haven't been able to do those healthier habits that I would have liked to have put into place, it's caused the rate of aging to increase. And now I'm on a mission to reverse that. So next time I'm back on this
Well, it's quite
podcast,
interesting,
Like,
isn't
I'm
it?
going to let you know. I
quite-
want to
yeah.
get back down to 20 again.
Yeah.
It's a good
But
case study, though.
Yeah,
Isn't it?
absolutely.
Kind of a good thing for you to focus on and show.
So how do
That's
you,
right.
what biomarkers do you look for? How do you measure
So
your
there's-
chronological?
Oh,
No, biological, sorry.
Yes, there's different ways to measure it. So
Okay.
I would say there's three main ways. One of the ways is looking at the rate of inflammation in the body.
Okay.
That's called the best test for that is the glycan age. They
Right.
do a really good test. And that looks at global inflammation in the body. Now, there's multiple drivers of inflammation in the body. It could be immune system dysregulation activated by things that you find foreign in your body. So it could be toxins, bacteria, pathogens, or it could be coming from your blood sugar response. So we know that high blood sugar is pro-inflammatory. High circulating insulin is pro-inflammatory. We also know that your stress responding hormones, if they're dysregulated, that also affects your immune system and your rate of inflammation. Okay.
Okay.
And finally, we also know that homocysteine, have you guys heard of that? Is a marker of methylation. It's one of the new markers
Yeah.
that we look at. We're not trained in traditional medicine. That is also been shown to drive systemic inflammation. So glycanage is good at that.
Okay.
Then there's and that's
We
the
need to
most
see
recent
who's
test.
Our
I
ages.
know.
I'm
Yeah,
intrigued.
Do you ever get people that have an older,
absolutely.
but that must be quite scary, but is that quite a good thing to happen because it makes people realize what they're doing and kind of get
Change.
them to change and shift what they're doing?
It is. It can be a
Yeah.
wake-up call, right?
Yeah.
Yeah, it can be another.
I
I
can
think
imagine it'd be
all your
quite-
blood tests are wake-up calls,
Yeah.
but
Yeah.
I like the biological age test because it just kind of brings some of it.
Do
All,
you do this in clinic?
we offer it to
Yeah,
patients.
okay.
Yeah, not as a standard test, but we offer it to patients that
Okay.
want to know. And then there's another form of biological age test is looking at your aging of your DNA, your epigenetic clock. That's quite a thorough test as well. And then there's physical aging, which is measured predominantly by the VO2 max score.
Okay, yeah.
You might hear that more and more these days. And that is a score that represents how well you take oxygen and make energy. And that decreases as we age, but there's things that you can do to slow that down. Some of the exercise strategies that I mentioned earlier. So it's a useful test. Like for me, I'm motivated again to get myself
Yeah.
back down to my 20s biologically. And I know what I need to do and I'm going to get it done. And I've started. So wish me luck.
Good luck.
Good luck.
Yeah,
Yeah,
thank you.
We'll look forward to seeing how you get on.
Yeah.
So what you must see kind of really advanced technologies and stuff kind of coming through. What do you think are the most promising or exciting longevity kind of?
I'm really
protocols?
excited about, we're at the, to be fair, we're really at the pioneering cutting edge of this stuff in the UK anyway. And we're applying these things on these cutting edge tools on patients.
Yeah.
So at the moment, the one that we're introducing and we've introduced for the last 6 months with great effects are peptides.
Yeah. Okay.
And it's a bit of a buzzword that is trending at the moment in the space. And peptides are a form of a molecular structure. So they just describe a type. It's like a sugar. There's many types of sugars. A peptide is a type of structure of a molecule. But what's been found that the peptides, if we can give you certain peptides, then peptides are great ways to deliver health change within your body. Because they are like switches. They regulate certain processes. Whereas drugs, when we give you drugs, they're not regulators. They're just giving you the end effect. So it doesn't help to regulate your own body to work a bit better. Most famous peptide at the moment is probably Ozempic and Mounjaro. That's an example of a peptide.
I didn't know there were peptides.
Yeah, they're peptide.
Yeah.
They're peptides, yeah. And but there are probably another about 15 to 20 that we're using day to day of different types of peptides. Now that's one for weight loss and blood sugar control. There's ones for lean muscle mass development. There's ones for fertility. There's ones for stem cell production and repair. There's one for immune modulation. So I'm really seeing great benefit of smartly, safely applying peptides
Are you
in
seeing
practice.
results
Yeah,
with?
good results.
Yeah, amazing.
For a variety of conditions. And we're applying that, we're applying that with alongside supplementation, alongside bioidentical hormones, making a personalized strategy, utilizing all these various tools. So I think peptides are an exciting area. You know what we just have a tendency as humans is that we just end up, wanting a quick fix. And the human body just generally doesn't like a quick fix because it requires multiple things. There's multiple systems to support. So if we just do the one quick fix, we're ignoring other areas and it starts to cause dysregulation. And a lot of men come to me and they ask me about TRT. And that's another form. And I'm like, look, no to TRT. Let's
Can you
start
explain what
working.
TRT is to listeners?
Testosterone replacement therapy.
Right.
That's quite commonly sought after amongst men because they're thinking it'll be a quick fix for a bunch of things, but in reality it doesn't. It causes longer term issues. And so we're working upstream to create the internal environment to make all of the systems work better. And they're like, okay, well, I don't even need TRT. And so the danger of like doing a drug-based and hormone-based approach is that it sometimes dysregulates your own production for the long term. And whereas this upstream approach to supplements and peptides, if you stop them, you don't have any deleterious negative effect for the long term. So they're generally a lot safer in the right hands. So I'm really enjoying utilizing peptides. I think the next frontier is stem cells, and really, really understanding for you what stem cell based therapy would work and for what. It's not for everyone. And at the moment it's quite expensive, and so it's not available easily, and particularly it's not available in the UK. But I think there is, I've tried it myself, something called exosome therapy, which is proteins that are released from baby stem cells, so umbilical cord stem cells from stem cell banks. And they release this growth factor or protein called an exosome. The exosome used to be thought of as a waste product of the cell, but now it's realized that it's a signaling molecule that signals your own body to regenerate and heal.
Well, and even within skincare, we're starting to see the use of exosomes in aesthetics.
Correct. Topically in skin, and so it's going to come where it is being applied systemically into the blood, so it regenerates other organs as it goes round into tissues.
But am I correct in saying that there can be dangers with human stem cells? Because even when I was speaking, I had exosome therapy with microneedling on my face recently, but she was saying that you can't use, or they don't use human stem cells because there can be dangers if your body rejects them or something. Is that correct?
Exactly, yeah. So giving a whole cell which contains someone else's DNA in the nucleus is problematic.
Okay.
Or carries some risk. And so there can be a role for it.
Okay.
And some places around the world do whole stem cell transfusions where they give the whole cell, but those will go through testing and making sure that it's a bit like when you do liver transplants or organ transplants, right? They contain other people's cells, tissues. So, but if you would go through a process of making sure that it's infection free, that there's a match, etc., etc.
Okay.
So that's possible with stem cell transplants. But the nice thing about exosomes, you don't need to do that because there's no living DNA and it's not a living cell. It's just a protein that's removed. So I think that's going to be quite promising, the potential of that for the treatment of neuroinflammatory disorders, development of Parkinson's, and other types of conditions, or regeneration of heart tissue after a heart attack.
Is it something that you think will become available here?
Absolutely, yeah. I think
exciting.
It's just a matter of time,
Yeah.
Okay.
I think it's you.
Is it? What are we up to?
Gadgets.
Oh,
this is a good one that I'm intrigued to know about.
And which gadgets or tracking tools do you personally use and recommend?
So I'm using the Oura Ring at the moment. I was using a Whoop.
Yeah.
And I've ordered the newest version of the Whoop yesterday, actually, just because I've started more strength training. I like the fact that they can do your VO2 max score on there as well.
Okay.
Yeah, and I've heard it's from people that have done an actual VO2 max and a predicted VO2 max. So they provide a predicted VO2 max.
Right.
It's quite comparable.
Okay. Does a Whoop measure your sleep as well? So do you need both?
No.
Or would you recommend a Whoop over
one or
the other? Okay.
I think the Oura Ring or a ring for me is really good for people that are looking to heal more, regenerate, know how to recover better and smarter.
Right.
And I find that I'm looking forward to giving you feedback on the Whoop.
Okay.
But they're both great, to be honest. They're both great, and the software on the back end is developing at a rapid rate.
Can I ask what your thoughts are on the EMFs that they give up?
I have
because I've had one
into
before
this.
and I felt like I could feel it. I've got an Oura Ring, but I felt like I could feel it. I'm quite EMF sensitive, so I wondered, whether you think that it kind of outweighs the benefits, or
no, I don't think it outweighs the benefits.
Okay.
Of it, I think they've been around for a bit of time.
Yeah.
You can switch the Bluetooth off. You can put it in airplane mode.
Okay.
There's things that you can do with a lot of these devices to mean that it's they're not always on.
Okay.
Yeah.
I know. We can't escape it, can we? But EMFs in general. But I just wondered what your thoughts were.
Yeah. my thoughts on EMF is that I think there's some more foundational things that everyone should be addressing first.
Yeah.
They can to seek to optimize their health. I think there is so it comes further down the line for me in my approach to working with patients.
Okay.
So looking at their hormones, their gut, their digestion, their immune system, their inflammation, their metabolism, all of those things will produce much more health than
not wearing an Oura ring.
not wearing an Oura ring.
Yeah, fair enough.
Or, but having said that, people that do use earthing sheets in their bed, anecdotally, they tell me they have much better sleep. I haven't tried it myself, and that's going to be another action thing that I'm going to try.
Yeah, I've got one that really good.
Yeah, I've heard from many people that they're using an earthing sheet is a really cool thing. They've noticed an improvement in their sleep, so I'm going to try that.
Okay, so carry on as well. I felt like I interrupted you mid-flow when you were talking about your tracking tools, devices, and what gadgets do you love?
I'm using a glucose monitor at the moment, so I'm using one on my arm. I'm using a Lingo because that's one I'm using at the moment. I've used other devices before. I like to do that once every now and again. Use it for 2 weeks, see what foods I'm reacting to. Interestingly, the almond milk brand that I use in my almond latte is spiking my blood sugar higher than I would like. So all that time I thought
if you want to get your age down, you need to
use the almond milk.
Yes, who would have thought? But I mean, that's really helpful for me. Now, like even just today, I made a nice smoothie and with protein, because I'm trying to increase my protein intake while I'm training. I was like, okay, that's pushed me a little bit higher than expected. Tomorrow I'm going to add almond butter and see what that does to it.
Okay, so I'm now it's good to be able to play with it and
play around my food to see if actually I can, achieve those things. So those metrics, if you look at them and you look at the way and adjust the way you live,
especially because with your understanding as well, it must be.
Yeah. It's helpful. So tomorrow what I'll do is I'll put almond butter in, see if the fats I'm introducing into the smoothie will slow down the absorption of the carbs coming from the berries and the raspberries that frozen berries I'm putting in there, and to see if it will curb my glucose spike or plateau a bit, making it a bit shallower. So I'll let you know on the next podcast.
Yeah.
What protein powder are you using? Only because some of them are so sweet, aren't they? You have to be really careful with certain protein powders. So it's just wondering whether you can,
what brand do you recommend?
Human.
So you have your own protein.
Yeah. Okay. So we're a functional medicine supplement range. So we've got a range of about 40 supplements that we use. We don't heavily advertise our supplements, but we have an online store where you can purchase them.
Okay.
With protein powders, I recommend 3 types. Cycling your protein powders.
Okay.
And you're right, be careful of the sweeteners that are in there. I use an unflavored beef collagen peptide protein at the moment.
Okay.
But I will rotate between that, a split pea protein, and then also whey protein. But the whey I'll make sure right now, I did my gut test because I do my annual test. One of the tests I found out is that, my dairy antibodies levels have started to rise again as well.
Okay.
So I've cut out dairy. Subsequently, I'm treating my leaky gut, and I've gone onto a beef collagen peptide protein.
And then after you've treated your gut, do you feel like then you're able to tolerate these things again?
Yeah. Once you fix the leaky gut, and there's protocols that are evidence-based, by introducing things that will help the small intestinal cell junctions repair, and remove the things that are driving inflammation, give it a bit of rest, then you allow it to heal, and it heals back up, and then you can reintroduce and test.
Nice.
Just seeing how you respond.
Okay.
And you will see if over the following 72 hours if you have any sensitivity to those foods.
How do you know if, in a quick way, how do you know if you have leaky gut? Would you have symptoms of bloating
90%,
and discomfort, or
so 90% of autoimmune conditions are associated with leaky gut.
Okay.
So number one, if you've got an autoimmune condition like eczema, psoriasis, hay fever, asthma, rheumatoid arthritis, any autoimmune condition that you've been told that you have, more than 90% of them are associated with some leaky gut, intestinal permeability.
Which is so interesting.
I was just about to say, because you had psoriasis, and I feel like it's cleared up because you now
But
eat
because
so
I had
different.
a stomach ulcer years ago as well, so I just feel like all of that just makes sense, because I used to get really bad psoriasis and I couldn't really figure out what it
Why?
was
but
or
now
why.
after you have all your bone broth and you eat
Yeah,
so
my gut is
differently,
so much
you eat so
better
many
in my
less
skin.
ultra processed foods,
Yeah,
don't you?
yeah,
Yeah.
so much cleaner.
You
So you
healed your
probab-
gut and you can tolerate
I
it
know.
now.
Yeah. So
There
no,
you
it's
go.
just you've pieced that together for me. So thanks.
Yeah. And that I didn't believe that as a doctor, learning that in functional medicine. And when I learned that during my functional medicine training, I was like, this can't be real. No way. These complicated diseases that we're giving steroids and calcitriol and vitamin D analogs and all these other things and biological agents, surely that's the best way. And
Heal your
then
gut.
actually just applying it to patients and say, okay, look, I've got a patient, she's got autoimmune thyroid condition. My first patient I did functional medicine with, and we tried her with the nutrition and supplement plan. And lo and behold, her antibodies went down in her blood. She felt better. Her water weight went down. Her energy went up. She felt better and she had more health. And that was the light bulb moment. It was like, okay, I believe this now.
Mm-hmm.
It was just theoretical before. I was like, this can't be real before. And then the whole number of conditions that we've treated autoimmune subsequently, I mean, this was going back 10 years, and starting with the gut, it plays such a massive role. And it makes sense if you think about it, right? So as basic as our immune system gets activated to things it finds foreign, right? That break into our blood, and then our immune system gets alerted to it. So where do things come into us from? Right? It comes in through what we breathe, but actually the nasal tract's got hairs, it's got mucus that we produce, generally quite good at keeping stuff out. Skin's quite a strong barrier usually. And the other one is our digestive tract. Now the digestive tract is only one cell wall thick between what really is the external environment and the internal environment, right? Because everything going through the mouth is actually outward facing, right? It's external facing. Is processing foods that we're putting in from the outside, and then there's just one cell wall between the blood that the cell then takes the nutrients out and puts it into the blood, and then it goes into the blood around the body and delivers it to the cells. So if there's a problem with it between those cells, things are leaking in: bacteria, viruses, pathogens, toxins, chemicals, waking up our immune system. Because our immune's like, oh, that's not normal to me. I'm going to create an antibody response to it. Oh, there's, as an example, oh, there's COVID. That's a virus. I've got COVID antibodies now. And so that's how our immune system works. And then all of these pulses of low-grade immune response equals symptoms, and they accumulate into manifesting in different organs. Psoriasis in skin, alopecia in your scalp, joints, rheumatoid arthritis. And that question is never answered in your training as a doctor. You're never told, why does someone have an autoimmune condition? How do we identify why they have it? Why do you have psoriasis? You probably would have asked your doctor a million times, and they would have said, look,
well, like it was stress or something that was causing
non-specific without being able to treat something, right? And so it's great to have these tools now in functional medicine to be able to look a bit deeper with this testing and identify for you why you're manifesting this immune response, and then you've got something to treat and go after.
Dr. E, what is your take on supplements? Do most people need them? And if so, how do they know which ones?
I use supplements a lot in clinical practice to help people move their health state. And I see supplements as support. They support your biological systems, your own tissues and systems to work better. Now, why do we need them? One of the theories is that our food has more calories but less micronutrients.
Depleted.
It's depleted, right?
Soils,
like it's just like not rich, nutritious food anymore that we're getting in the most grocery stores. Why? Because the soil is depleted. It's been removed of things. Sprays have been put on the herbicides, pesticides, which means that we're not getting as much nutritious food from the foods that we are cooking with and eating. So that's one theory. And if you accumulate that paucity and the lack of micronutrients, then over time it contributes to disease, absolutely, 100%. And so we have a dispensary of alternatives to medications that we use as supplements, that we can prescribe to patients that are compounded to treat certain things, as things that will reduce your cholesterol, things that will improve your blood sugar response, things that will improve your thyroid function and calm down your adrenal glands, things that will treat leaky gut, things that will treat small intestinal bacterial overgrowth, all of these functional imbalances. So I'm a big fan of supplements. However, there is a huge variability in quality of supplements. And how do you ascertain if something is high quality and if you need it? Because we've all been guilty of having a pantry full of supplements that we dip in and out of. And why do we do that bit in the first place? Because our intention is to feel better, but when we take them, we don't really feel any difference. Let's be honest, right? And so we just take them on the idea that, okay, I'm getting a bit of a cold. I'll just, take a bunch of these and I'll feel a little bit better. Supplements have been around forever, right? Like we grew up with cod liver oil and so they've been around for a long time, but I think they've evolved. The higher end of supplementation are super high quality and they move the needle. They're high quality ingredients, just like you get difference in types of food quality. The supplements, where they're coming from, where they're deriving from that food, is variable. So the higher end of supplements moves the needle. Unfortunately, the lower end of supplements can actually be problematic. You think of Centrum, at one point, the number one most sold multivitamin globally, has more than 20 known carcinogens in, things that drive cancerous changes at a cellular level. Crazy, right?
Yeah.
And so one piece of advice I was given by one of my mentors was, if something is solid, tablet wise, then throw it away.
Really?
Because it's got fillers in and additives.
Yes,
It's
I
got,
heard
it's got fillers in, which are non-synthetic compounds to hold those individual ingredients together. So I like look at your supplement. Is it loose powder capsules? Is it microcellulose capsules with the loose powder inside? Generally, that's good. Do they, and then that's a good way to ascertain. And it really depends what you're looking to achieve with your supplements. If you've got a disease, then you should really get expert advice to help you, guide you through, because you're unlikely to be able to get out of your disease state with just supplements and listening to some advice that you hear online and then just trying supplements. And I really recommend anyone that's got a disease. However, if you're well, then you can start to play around with supplements a bit more. You can see if cordyceps works for you and how you feel when you take it, or functional mushrooms or curcumin and things like that. There's some supplements and ingredients that are more powerful than others, and not everyone needs the same set of supplements. And finally, I genuinely don't believe you should be on supplements for life. You can cycle on and off supplements, but really depends what you're looking to achieve. Yeah.
Okay, interesting. And it's hard, isn't it? Because I remember even when I was pregnant, there was only Pregnacare. This was 12 years ago or whatever, 13 years ago now. And you'd go into Tesco's and it's like you'd see Pregnacare but actually they're synthetic and your body's not going to recognise them, and they can do more harm than good. And they use folic acid instead of methylfolate, which is crazy, isn't it? Because actually these supplements are, as you say, are doing more harm than good. And it's just scary that I think that they're even allowed.
It's a very unregulated space.
I know.
And it comes back down to the definition of health.
Yeah.
Okay, so everything medically is classed as medical is regulated, and that's like anyone that claims they're treating a disease. But anything, if you're not claiming that you're treating a disease, but you're supporting your health, then that's kind of regulated, not by the medical bodies, you're regulated now by the food standard authorities. And so I agree that I think there should be a bit more regulation on the claims that are made by the supplement and the checking on the quality of ingredients and the sourcing, but it's just a lot of work to do by the regulators.
But it's just sad, isn't it, that people are taking these things thinking that they're making a positive difference to their body,
It is sad.
And they're being misguided.
It is sad. But they also, I completely agree, and I think hopefully we've hit that plateau now. I think because there's so much advice that's out there now that you can switch on your TikTok and Instagram, and
true.
Everyone's giving health advice and on different things. And one thing I would say is that get your health advice from someone that has worked with people that have problems.
Okay.
Yeah, be it a health coach or a nutritionist or a doctor or someone that has actually applied to a variety of problems or health problems, and that they're going to have some experience.
Okay.
Not just on themselves, because what works for them doesn't mean it's going to work for you.
Yeah. And I think this is a massive thing even within social media. We're just overexposed to different information. It's all conflicting and no one knows what the right thing to do is anymore.
Until you've tested your blood and know what works you need, then
Yeah, and you need to have some expertise. Like that's why you have experts out there, right?
Yeah.
And what I mean by that is, you can do your own tests. It's a great starting point, but don't try and interpret that data yourself, in my opinion. Go to someone that knows how to interpret that data, because they will do a better job and actually get you to your results a lot quicker than you experimenting on yourself. I've seen so many people that have come to me who've got themselves into a health state because they've been overexposed to trialing different things themselves and testing it and trying to work out their blood test results themselves, and they can get unnecessarily worried about things, or they can miss things. And I think that if you can just try and go work with some experts, generally
save
makes such a
lot of time. Yeah.
So I'm going to ask you about future-proofing our children's health, and if there's anything that you think we can do as parents.
Yeah, absolutely. I'm not a parent myself yet, but I've got 4 nieces and nephews, and extremely close to them. And I've seen them grow up, and been around them a lot. So I've often thought about this. It's like, in this rapidly changing time that we're living in, technological time predominantly, so rapid, right? And you can see the variability in children. Some people that are engaged to they cannot be removed from their digital devices. I think the number one thing to do is, I think you've got to start there. I think understand, and I understand it as a I'm not a parent, but as a potential parent as well, that it's hard to kind of keep an eye and keep your children busy and engaged and activated with things, and the iPad helps, but the iPad and the exposure to these digital devices is changing their neurochemistry and their neuroplasticity and the way they think and the way they it will affect them. So controlled exposure, you have to be able to be quite disciplined. They cannot get away with, as they're growing up to become teenagers, you cannot get away with not engaging with technology. They need to learn how to engage with technology. But I think that's a real challenge for us all now, is how do we create children that engage responsibly with technology and use it for their advantage without it affecting the way they will think and show up in the world. And that's one of the biggest challenges that we have. And the same challenge then can be applied to our nutrition. I think the sooner you can get children seeing how vegetables are grown, getting onto a farm, understanding where their food comes from, making the connection, maybe educating them on how is processed food made, and showing them how the colorants are made to make their sweets, and actually I think just inspiring their curiosity, helping them understand things on our food chain will be really helpful, and inspire them to want to have an orange instead of a Fanta. I think it does work, right? But you got to treat them in some ways as an adult, right? That you got to take them on that learning journey.
Yeah, but I even think for adults we need breaking down sometimes. Like I saw something recently, and it was talking about pesticides, and they said if an adult saw that if pesticides had a colour and they weren't clear, would people still eat them? But it's because they're clear. And it's like, when I had that association, it was like, oh my God, because we don't see them or taste them, we don't notice that they're there. But actually, if you saw them, would you still eat? You could see it being sprayed on.
And all this stuff is being done without our knowledge, right? And we have to go out to find that knowledge.
Yeah.
And then that's and then educate our loved ones around it.
Yeah.
Naughty.
It's naughty.
It's naughty.
Sorry. Right, should we jump into a quick fire round, if that's all right with you? Yeah. Got some quick fire questions.
Okay. What's one supplement you never skip?
NAD.
Okay.
I love that. My favourite supplement, because I feel so good after taking it.
Yeah, I felt really good when I left your clinic, especially because I had the hyperbaric. I did everything and I was like, I was buzzing afterwards. It's so good. One test that everyone should take at least once.
I would say the leaky gut test, because that's quite easily actionable.
Okay.
Yeah. The gut barrier panel test, that's what we call it.
Okay.
Okay,
Yeah.
sleep, food, movement, or mindset, which comes first?
I think you go through phases. For me, I'm movement focused at the moment.
Okay.
Yeah,
Yeah.
I think I go through phases.
I think everything else regulates, doesn't it? Once you move, it kind of everything else kind of
Yeah,
falls into
movement.
place.
Yeah, movement is super important. Yeah. But if you're in disease, I think sleep is super important.
Okay.
Yeah, sleep and nutrition.
Okay.
I mean, that's really difficult, isn't
It
it?
is, isn't it?
Yeah.
Yeah. What's one outdated health myth that you wish would go away?
One outdated
Yeah.
health myth. That LDL is bad.
Yeah.
Not
So true.
all LDL is bad.
Can you break down what LDL is for people?
Yeah, so LDL cholesterol is low density lipoprotein cholesterol. And the low density lipoproteins are made up of different types of lipoproteins. We used to clump them all together, and we still do in traditional medicine, and we use that as a marker to determine whether you're going to have cardiovascular disease or not. However, there's multiple things that drive cardiovascular disease. LDL is one of them, but not all LDL. Some parts of LDL are bad. So the ApoB and your LPA are the two lipoproteins that carry increased risk, not the others. So you can have a high LDL but a normal ApoB and a normal LPA. So that means you're not at increased cardiovascular risk. But there's other elements of cardiovascular risk, disease risk progression. That's your blood sugar control, that's your methylation, and that's your generalized inflammation state. So those four things need to be taken into consideration when coming up with a long-term cardiovascular disease strategy.
Yeah, because years ago, I mean, not that long ago, I suppose it was like high cholesterol equals bad. So it was like everyone was like low fat,
No
that is
butter.
bad, no butter,
Yes.
all these things. So that's the whole,
And then margarine came along.
Oh.
And, yeah.
There we go.
Yeah. Don't eat
processed
margarine,
things.
guys.
Yeah, don't eat margarine.
Coffee, yes or no?
In moderation. Yeah.
Okay, yeah,
For
you
me,
like
yes.
coffee?
I
Good,
like coffee.
Favourite health gadget or wearable? We've touched on this, but what's your
Okay,
favourite?
Most fave.
Most fave, I think, the one that's been most consistent in my life has been my Oura Ring.
Okay.
Yeah.
If you could prescribe just one habit to every patient, what would it be?
It would be one superpower. A habit that becomes a superpower is emptying your mind.
How do you empty your mind?
Just practicing emptying my mind.
Okay.
Just policing them.
Journaling or visualization?
Journaling
Okay.
helps me on the train back. That's one good thing about commuting. I use
Okay.
the journey back to journal, and that really helps me.
Okay.
But then also just practicing emptying the thoughts out as they come, letting them go, and I get better at it.
Okay.
I find that's really, really helpful, because that's often a trigger of a lot of biological sequelae that drive disease, stress.
Yeah. Okay, thank you.
One book that changed your life.
Start With Why by Simon Sinek.
Okay.
I definitely recommend reading that. That's the one book. It really helped me consolidate my value system, understand and articulate my value system, my purpose and my mission.
Oh,
Yeah.
okay.
Gonna check it out.
Yeah. And what's one thing that you wish more people understood about their own body?
That your brain generates thousands of thoughts a day, and you don't need to think. When you think about those thoughts, you give them a purpose.
Okay. There we go.
Well, this has
Dr.
been
E.
extremely insightful, and we've absolutely loved this conversation.
Yeah.
I've loved it as well.
So
Thank
many
you, guys.
great takeaways.
Where can people find you?
You can find me on Instagram at by.dr.e, so by.dr.e. At our website, human.com, HUM2n.com. And thank you.
Amazing. Honestly, thank you so much.
Yeah,
It's been great.
Thank you.
Yeah, it's been amazing. Thank you.